We'll get started now. Thank you so much. Welcome to our Staying Strong Together series. Um, Today we will be having a discussion about empowering the Black community and the impact of dementia. My name is Brandy Alexander. I'm the National Director of Community Engagement for Compassion and Choices, and I will be your moderator today. Just so we are all clear, there will be recording today's session. Please also note that everyone is in view only mode. This means that your audio and video functions are disabled and neither will appear in the recording. If you do have any questions, we'll have a formal question and answer session at the end of the conversation. And to ask a question of the panelists today, please type it into the question and answer box on the screen and click send. Please note that you can check send anonymously, so if you don't want your name attached to the question. And we'll answer as many questions as we can with the allotted time. I'm excited for our panelists today. We have Dr. Sonia Richmond, Dr. Jeff Gardier, and Artemisia Missy Moore. Dr. Jeff Gardier is better known as American Psychologist. He's one of the most widely sought after experts in the field of mental health. In addition to having a private practice in Manhattan, he's the associate professor and course director of behavioral medicine at Touro College in New York City. Dr. Jeff is also an ordained interfaith minister with a doctorate of divinity from the New Seminary. He attended the University of Rochester, where he gained a bachelor's degree in psychology and continued his education at George Washington University, where he gained his PhD in psychology and philosophy. He's an author of 4 books and a contributor to over a half a dozen others. And you've probably seen him on NBC, CNN, MSNBC, Fox News, just to name a few. So welcome, Dr. Jeff. Next, we have Dr. Sonia Richmond, who is a board certified internist and board certified hospice medical director. For over 20 years, she has worked in roles across internal medicine and hospice care, as well as a medical director, providing care for patients in complex clinical conditions. Dr. Richmond's primary focus is enhancement of the quality of care for patients and their families experiencing life-limiting illnesses. Born and raised in Miami, Florida, to immigrant parents of the country of Guyana, Dr. Richmond incorporates her unique perspectives to the multifaceted cultural complexities that face our healthcare, especially in the settings of end of life. In addition to her medical career, Dr. Richmond is a certified yoga instructor and been practicing yoga and wellness for over 15 years. With her extensive medical knowledge infused with yoga philosophy, Dr. Richmond provides a distinctive interdisciplinary approach to the care of the patient, body, mind, and spirit. Dr. Richmond received her undergraduate degree in biology at the University of Virginia. She also attended George Washington University School of Medicine for medical school and residency. Dr. Richmond lives by Maya Angelou's quote, "I've learned that people will forget what you say, but people will never forget what you do, and people will never forget how you made them feel." Thank you so much, Dr. Richmond. And last and certainly not least, we have Artemisia Missy Moore. Missy's nursing experience and knowledge in nursing spans back over 30 years. She's a certified Alzheimer's and dementia instructor, as well as certified in wound care and staff development in long-term care. She's an expert in mental health, first aid, wound care, hospice, care of the aging, IV therapy, and scope and regulation of practical nursing. Missy's a member of Compassion and Choices African American Leadership Council. She's a lifetime member of the National Black Nurses Association and served on the board of the District of Columbia State Board of Nursing and other appointed committee positions, including the past president of the National Federation of Licensed Practical Nurses. Missy's motto is to live to inspire others. Thank you guys so much. We're looking forward to your discussion.
Fantastic. Thank you, Miss Alexander. Always a pleasure. Dr. Richmond, Miss Moore, I'm so glad to be on with all of you again. Here we are doing our thing, working together. Great to see you both again.
Hi,
Good to
Dr.
see you,
Jeff.
Dr. Jeff,
Thank
Dr.
you.
Richmond.
Thank you, Miss Moore.
So one of the first things that I saw, Sonia, is that both you and Missy have mottos that you live by. And I think that's really amazing because it's something that I think we all should have. And I'm going to have to find a motto. But right now, I think my motto is be in the good company of people like yourselves, because that's important for not just our spirit, but also for our mental health. And one of the things that I know that we have found in studies and through some of the anecdotal evidence and the work that we've done is that it is so important to keep our mental health going as much as we can, and having people that we can lean on, having a support group, all of those things really can help us not only stay sharp cognitively, but as well when we start dealing with something like dementia, which is something that we, of course, experience in the African American, Black and Brown communities, all of our communities. Certainly, we do know that can help us with regard to not the term that we use, decompensating so quickly, having that familiarity. And those are some of the things that we'll be talking about today, right? This whole issue of dementia.
Yes, Dr. Jeff, so as a caregiver, I currently care for a wonderful woman who has dementia, but also from my nursing practice, what I've seen anecdotally in Brown and Black people is that I think that their families see symptoms early on, but they dismiss it
Yes.
as they're putting on, or they want attention, or they just act like it's nothing wrong. Um, or they say they're not taking their medication when maybe they are taking their medication. They attribute it to everything than what it really is. And I think that's why we might see um, brown people in stages that are more advanced because they weren't given any treatment earlier on.
Right.
I
And
agree with
and
you.
that is important. If I may piggyback on that, Missy and Dr. Jeff, um, the advancement of the dementia, you know, the unfortunate thing is that dementia is not reversible. It will progress. There are medications that can benefit someone early on. So when the dementia is detected, those subtle signs of our loved ones not necessarily being as coherent or as attentive, and having that network where you can reach out to your healthcare provider to share these concerns. And this may alert that healthcare provider to ask more questions. It opens the door to so many opportunities of outreach and support, one being medications. And, you know, we will explore that later on in our podcast, but those medications that help curtail or slow down the progression of dementia are most beneficial at its earlier stages
That's
when we are often in the denial stage.
That's right. So, two things that you said, which is important, is that yes, we need to have better relationships with our physicians, but as we know, we don't always trust our American medical system. So that's something that the three of us, and certainly Miss Alexander, through Compassion and Choices, has been pushing as much as possible to get us to be out there and to rebuild that trust, especially when it comes to end of life care, which that information out there, that's a health disparity. We don't talk enough about that in the Black and Brown communities, right? So, it's also important, as we talked about earlier, you got to have friends, you have to have family who can help guide you and support you while you're going through this thing that we call dementia. And the other thing is, it is the denial. People don't want to deny that their loved ones are slowing down, or those people who are actually starting to experience the dementia, may not be aware of it, or they may realize that they're starting to forget things, but maybe, they don't want to deal with it. So I think it's important that, because there isn't enough information out there, why don't we start, if you don't mind, why don't we start giving them, some of the definitions as to what these dementias are. And if you wouldn't mind, may I go ahead and start and talk a little bit about that? Yes?
Absolutely.
Okay.
Absolutely.
Missy, do I have your permission?
You do, Dr.
All right.
Indeed.
I take orders very well, okay?
Right.
So let's start with a little bit of education here and talk about what is dementia. Well, dementia is a loss of cognitive functioning. What we're talking about, cognitive, meaning thinking, remembering, that we don't reason to the point that we just did. But it's not just problems with thinking and forgetting things, not having the best judgment. These are some of the things that we see with dementia. And of course, you two will also, chime in whatever I'm missing here. You can give us certainly more, but it also interferes with our daily life. Let's face it, as we start to get older, as some of us become senior citizens, there's only one senior citizen among the three of us, and we know who that is. Hello there. We know that we begin to slow down, right? The focus may not be there as much as it once was, or we don't, we're not as, pinpoint sharp. But of course, one of the things we know is the more that we continue to exercise our minds, it is a muscle, that sometimes we can stay as sharp as we want to. But dementia is something else. Dementia is actually part of an illness, and its progression, as you talked about, Sonia, is progressive. So there are a couple of dementias that we want to talk about. There are many, many different dementias with what we call neurocognitive disorders, right? Neurological cognitive disorders, things going on with the brain. But one of the biggest dementias that we see is part of Alzheimer's disease. And Alzheimer's is a progressive disease that destroys memory, most importantly. And what we see is that eventually, physiologically, the brain cell connections and the cells themselves degenerate and die. And that causes more memory loss and other mental function impairments. As you talked about, Sonia, no cure exists right now, but there are medications and management strategies that we will be talking about, especially if you start early. The other one is dementia of vascular neurocognitive disorder. And here, what we're talking about, this is the second leading cause of dementia after Alzheimer's disease. This vascular neurocognitive disorder, this is characterized by disruptions in the brain's blood supply that leads to the impairment of some of the things that we talked about: forgetfulness, a weakness on one side of the body sometimes because of strokes, problems with attention. And this is why we need to pay attention, because vascular dementia is caused by conditions that occur most often in older people who've had things such as hardening of the arteries, but also younger people who have heart disease, diabetes, obesity, and stroke. And those are the things that disrupt the blood supply to the brain, that causes those strokes. And what we call those infarcts are those things that cause those neurons and cells to die. And so this is a dementia that we see that can happen a little bit earlier, because it's not just something we inherit, but comes also and/or also from the lifestyles that we may have, or illnesses that we may have. And then there are others such as Lewy body disease, which is a different kind of abnormal deposit of protein in our brains. I know I'm getting a little bit too technical, but that also causes problems with thinking, movement, behavior, and mood. Parkinson's disease, we find that because of that, the shaking, the stiffness, the difficulty with walking, all of that comes, from, issues with neurotransmitters in the brain and so on, but we can see a dementia begin to start there. And so those are the major ones that we deal with, but especially Alzheimer's, of course. And, when we talked about the whole issue of vascular neurocognitive disorder. So there are a lot of things that can happen there. So, come on, jump in there, Sonia.
If I may, Dr. Jeff, I think the message that I would like to share with our audience, with our community, is that unfortunately, yes, dementia can be broken down into different categories. You know, but what we do find, which is very common amongst all forms of dementia, is that it not only changes and affects the lifestyle of the person who is affected by the dementia directly, but it also affects the lifestyle. It affects the emotions of the caregivers
Oh, yes.
that are in the lives of this patient. It does put a significant burden on our healthcare system. It changes the trajectory of so many dynamics in the household, where it may require additional family members, additional support, a financial burden and support. In all of the dementias that we have discussed, while the mechanism of action behind the scenes may be different, what I find clinically is that unfortunately the patient loses their memory. The execution of functions and higher level of execution is compromised. Oftentimes you find that patients with dementia are at higher risk for infections, hospitalizations increase, risk of aspirating or choking on their food, having to adjust their foods, increase of falls and fractures. And so it's this domino effect. And I love the way that you broke all the different aspects of the dementias down, because it does help the physician guide treatment in different ways. But ultimately, in the end, persons, families are still left with caring for someone who's no longer who they were before. They are a shell of themselves and affected functionally, cognitively, in so many ways, and even spiritually as well. So it's a component of suffering in many ways. So I am so honored to be here to discuss this and expand and explore and question and share, because it is important, it's valuable.
I agree. And one of the earliest signs that we see of this, and I've seen it over and over again. And Missy, I'm going to ask you, what are some of the initial signs so we can recognize this early, right? Because Dr. Richmond talks about the importance of getting early care, of getting diagnosed. And there are different ways that you can get diagnosed. So we should talk about that too. But one of the things that I've seen over and over again, someone with dementia gets behind the wheel of a car and they drive, and
Don't know where you're going. Yeah.
they're calling you from another city, they're completely lost, they're miles away from where they live and they can't find their way back. That's one of the initial things that I've seen, or forgetting where they put the car keys consistently. What are some of the other early signs that you've seen?
Not being able to find things, or saying that people stole things, or not remembering what you said, or that somebody is doing something to them, or to their family, or to their car, or to their keys. Also, not eating, not taking medication.
And forgetting that they did not eat, or forgetting that they even ate anything.
Forgetting that they did not take their medication, and to either don't take it or take too much. Also, they may start to lose their bowel and bladder initially, but not say anything. Also, they're pretty belligerent when you ask them something and they can't remember what it is, because people be like, well, what do you mean you don't know? Not realizing that the more you push them, the more agitated that they're going to get. And that could be sometimes for the patient and sometimes for the family member too, because, two of the things that you, Dr. Richmond, and you, Dr. Jeff, just explained is about, that there are medications, that there are things that you could take that, is different disease processes that bring this on. But a lot of family members, when they have dementia, they'd be like, well, all we need to do is give them the medication for dementia. But in the case where you were talking about vascular disease, well, yes, we still need to give them the medication for the diabetes, and we still need to give them the medication for their blood pressure. That part never seems to get translated to the family. So the patient they're taking the medication for dementia, but they're not taking it for their blood pressure. So it may seem as if their symptoms are getting worse or that they're declining. So that the process of that caregiver education is so important, because you get so overwhelmed with everything that you have to do. You have this person that could do everything, and now it's this person that's belligerent. They don't want to get showered. They won't take their medication. They won't go to the doctor, and you're trying to do that. People may be working. Some of the things that I try to help caregivers with is, and it may seem a little silly, is a really big laugh, because sometimes some of the things that the patients tell you is so out of this world that if you get angry with them, then both of you are angry. So you just have to step away and laugh really hard. I mean, I have a great sense of humor, because I don't want to be angry with them. If you think my mother's a rocket scientist, you know what? I'm glad to know it. A patient told me that one time. Your mother's a rocket scientist. And I said, well, now that explains why she acts the way that she acts. And we got along great the rest of the day. So, trying to support the caregiver with what it is that they need, with whatever symptoms and things like that they're seeing, is important. And they need instruction along the way when they start, but all the way through. I think they might get some information in the beginning, but as the patient changes, the instructions need to change, and they need to know how it looks further out, so that they may not hear you, but they can always go back to what you told them. Oh, you know what, they told me in 6 months that this might look like this. And
Well,
I think
yeah, but a couple of important points that you're making is, what you're basically talking about is sometimes we see that with the dementia, at times they can develop what's called a psychosis. In other words, they develop delusional behaviors. They have belief systems not based in reality. Sometimes with people with Parkinson's, they actually have hallucinations, they have paranoia and so on. And so it's important that the treatment be there for them. But even talking about, and I'd love for us to talk about the treatments that are, how you get diagnosed and what are the treatments. But before we go there, when we're talking about vascular dementia, again, the important thing is we have more control over that than Alzheimer's, right? Because Alzheimer's may be purely more genetic, or some other things are going on that may be, out of our hands. But we know, for example, that there may be a correlation between people who are severely depressed and then being at risk for Alzheimer's. So we have to be careful of treating our depression. And we know that's an issue for us in the Black and Brown community, but it's also our physical health. We really have to pay attention to that, because then we would be less at risk for things such as vascular dementia if we took much better care of ourselves. But that being said, Dr. Richmond, how do people get diagnosed? First of all, if you think something is going on, what are the first steps? And secondly, what do we need to do in our homes? It's not about getting them hospitalized. It's about now adapting their environment so that they can, do better there. So when they're losing things, for example, it's easier to find them, right?
It's, I live by the motto, another motto of
Another
meeting,
motto. I've got to find a motto, for heaven's sake.
of meeting that patient, meeting that person where they are. So sometimes what I find is that many many people who are afflicted with or have dementia sometimes resort to very adolescent behavior, childlike behavior.
Mhm.
So it's instead of the room being upstairs, it's having the room downstairs in a location that's more safe. So having to navigate the stairs is no longer an issue. Putting people and parties in place to care for them. Removing the knobs on the stove can even help. Removing the keys out of their hands so they can no longer drive. He or she can no longer drive. But what I find is that the diagnosis of dementia oftentimes comes, it's over time. And this is why it's so important to establish such a close-knit relationship with your healthcare provider, because oftentimes you see the changes where Mr. and Mrs. Smith was driving themselves to the appointments and now they're using Metro Access, or their son or daughter is assisting them to their appointments. You're hearing more about falls and admissions to the hospital. You're hearing more about increase in urinary tract infections or confusion. Oftentimes, it's the history taken by that healthcare provider, which puts those puzzle pieces together to help with the diagnosis of dementia. As an internist, we serve as the first line where we're caring for head to toe. But when we encounter aspects of dementia that we notice from the standpoint of physical examination, note taking, oftentimes we do refer and collaborate with a neurologist who may introduce further testing, imaging studies, MRIs, CAT scans, laboratory data, looking up medication, looking up treatments for even thyroid disease, looking up treatment folate deficiency, B12 deficiency. So there are a slew, or what I would say, there are a significant workup. You want to get to the point where you exclude all other possibilities. You want to address any aspects that could potentially be reversible. And once you remove that off the table, then you are left with the diagnosis of dementia, and it's supported by information that's provided mostly from the family. And this paints the picture. And this is when you, if you go down the route of electing a medication, you choose the best medication for that person. It's not a one size fits all. And this is
So,
when you,
so everything is not Aricept.
no, not Aricept. And as Missy shared, comorbids, those core morbid conditions, these are conditions that actually what they do, they play a role in your overall health. They may not necessarily be the first line issue that you're dealing with, because now you're dealing with dementia, but the high blood pressure, the diabetes management, the obesity management, all of that is still quite significant, and it requires some further adjustments because now you've added another significant clinical condition and change.
So, Missy, one of the things that you were talking about was what happens to the caregivers, right? Because the caregivers themselves really, we're talking about children, adult children for the most part, relatives, sometimes friends. That is a full-time job in itself, especially later on in the progression of Alzheimer's or one of the other neurocognitive disorders that we're talking about. And not only does it wear you down emotionally to see your parent or a loved one, declining in that way, and that change of personality where at times they can be almost impossible to deal with. And it's not their fault, by the way. You have to remind yourself of that all the time. But physically, it wears you down where some of these caregivers have had to be hospitalized, have had heart attacks themselves, have in fact been at risk themselves for, some of these conditions that we're talking about. So what's available for the caregivers so that they can get some sort of respite, so they can get some sort of support in doing this ever important job, this sacrifice for their loved ones?
That's a great question, Dr. Jeff. It's two things that I usually tell a family when I meet them, especially if they have a family member who may be having behaviors and they're absolutely worn out and angry. And I said, the first thing that I want you to think, I want you to understand is that they don't have any control over it.
Yeah.
And they said, okay, I'm trying hard to remember that. I said, and then the second thing that I want you to remember is that they're suffering.
Mhm.
And that really brings people to a very different place, because sometimes they don't see that piece of it. So I want them to understand they're going through it, but you're going through it too. But I just want you to understand that they're suffering as well. So that helps them to see it in another way. The other is just to really give the family resources based on what they want. Because if you give them too many at one time, they'll be like, well, thank you very much. They smile nice, shake your hand and lead you to the door. But, like for instance, a couple of churches in our area in DC, they have a mental health and dementia ministry. So, and what they do is they train the parishioners, and when people need an hour or two to get out or go to the bank or that kind of thing, then they would go to the house to
Wow,
support them.
that's great. That's
Isn't it
amazing.
great? And actually all of the parishioners were taught mental health first aid. Actually, I taught them mental health first aid so they would know how to react when they saw the behaviors. The other is AARP. They have great resources on their website to help you find some of the things that you need. They also have dementia cafes at the local Office of Aging, where you can go there. You can bring your family member that has the dementia. They'll set up an activity for you, and then the caregivers can either do something on their own while they're there, or interact with some of the other caregivers. But the most important thing is to ask for help. Ask for what you need, and also understand that it's not going to look the way that you would do it. So people will be like, well, I need some help, but they don't do it my way. Okay, well, they're going to do it the way that they know how. And if you want the help, then you have to accept the help that way that somebody wants to give it to you. So one lady was like, I need help, my husband. And I was like, well, what's the problem? She was like, getting the trash out. And I just happened to be at the house one time, and her neighbor was there bringing some groceries or whatever. And I was like, listen, do you think you can help her every week to get her trash can down to the end of the driveway? He was like, oh yeah, I can do that, no problem. When I take mine out, I'll take hers out. She said, I would have never thought to ask him that. And I was like, well, that's why they have me around. But it's very, very simple things that eventually start to take some of the task off of your list, so that you have more free time to either provide care or not, or just have time for yourself.
So ask for care. Ask for care. You don't have to do it yourself. It's
Right.
not a thing of where you're betraying someone or that you're weak. Ask. By the way, as you were throwing shout outs to these different organizations, AARP and so on, which I happen to be a member, by the way. Yes, they're a very good organization. Don't forget compassionandchoices.org. We have toolkits around dementia, talk about advanced directives. If, unfortunately you have to deal with dementia at some point in the future, it's important to have a health proxy. It's important to have everything in place. Compassionandchoices.org. Go there and you'll see our dementia toolkit. I've got to ask you, Dr. Sonia, how does dementia impact the Black and Brown community specifically? are we, I think perhaps we might be a little bit more at risk for vascular dementia, but do you have some numbers, some statistics that show how we are impacted or the way that we are impacted?
I don't have the numbers or the statistics, but what I do have is the hands-on approach or the hands-on experience of what I see from the standpoint of healthcare burden. Um, I have been fortunate to provide clinical care in a hospital setting, to provide clinical care in nursing home and rehab settings, to
Mhm.
provide home care settings, as well as hospice care and treatment. Um, and what
That's
I
important, by the way, that's more important right now because you're giving us the intimate look. So
yeah,
we'll deal with those numbers later, okay?
yeah.
Give us that intimate look. Give us that.
Um, so with the intimate look, what we look at, what we see, or what I've often experienced, is the increased length of stay in the hospital. And with that increased length of stay in the hospital and the significant complications associated with that increased length of stay, what it does is it affects your mortality, your morbidity and mortality. The longer you are in the hospital, you are more at risk for hospital acquired infections.
Mhm.
You are more at risk for developing breakdown in the body, wounds, which Missy is our expert on. And she can share with you, the components as to how wounds themselves pose a direct risk of increasing someone passing away. You are immobile, you're bedbound, and you are at risk for infection and compromise. Then we find that patients must ultimately go or transition to a skilled rehab environment and setting. They are still further away from their home environment, so that suffering is emotional. Um, you can no longer go home, not quite yet. So in that nursing home or skilled nursing home environment, you are still recovering here. So there too is another aspect of the risk of rehospitalization as well. Ultimately, when you return home, you are now established at a new, oftentimes lower baseline of your healthcare. So you went into the hospital, maybe taking one or two medications, which probably included a supplement or a multivitamin, a Flintstone vitamin for me in this case. But then when you are ultimately discharged from the hospital to a skilled nursing home, finally back to your home, you now have about 14 to 15 new medications that are
Wow.
new to you, potentially causing a lot of drug to drug interactions. And you may not necessarily feel good taking these medications. On top of that, it has also changed the dynamics of your home. Returning to work is compromised. Healthcare agencies are now entering your home, providing care at the bedside for you. And then ultimately, many patients, as I stated, unfortunately, dementia, the road down the dementia, it's not reversible. There is no U-turn when it comes to dementia. Everyone's road and path may look different, but ultimately, you will see the combination and the accumulation of a lot of complications, which ultimately lead to you passing away, you and your loved one, caring for someone who was passing away, who then would benefit from the supporting communities, from Compassion and Choices, from the organizations that Missy Moore mentioned, and as I stated, hospice treatment. Um, in the healthcare environment, what we're finding is that the diagnosis of dementia in Black and Brown communities is oftentimes coming about as a surprise, coming about later on when the medications are not beneficial and the ability to enjoy the quality of life and the services that are provided are not there, unfortunately. So it is a disservice. And oftentimes, family members are left with a broken heart because they did not get an opportunity to enjoy the quality of life that is more beneficial.
So the
So
important,
that is my statistic.
I
and that's
agree
and
with
that's strong. That's strong. Yeah,
Uh,
go ahead, Miss.
I'm sorry, Dr.
Go
Jeff.
ahead,
Dr.
Missy.
Richmond, I agree with you about the later diagnosis. And what I've seen is that the families are very angry because they can't get the medication. But part of the reason why they can't get the medication is because the disease is too advanced, but they don't understand that. They've already looked it up. They've heard that it does these things, but if their disease is so advanced that it won't do them any good, then the physician, number one, won't order it. And even if the physician does order it, insurance may not pay for it. And that makes the family very angry, very, very angry.
Displaced anger.
Mhm.
It's displaced anger. And oftentimes we may not look within ourselves and address certain or subtle signs that may have come about that you spoke about, Missy, because we swept it under the rug possibly, or we didn't want to open Pandora's box, you
Right.
know, and go down that road of acknowledging and witnessing someone that we love so much change right in front of our eyes.
So I've got to tell you, I'm feeling a real frustration right now. And that frustration is that I've heard this over and over again.
Mhm.
If I may just get a little bit personal here, I happen to be married to a physician. And it's only because I'm married to a physician that I am in the health that I'm in, because
Mhm.
every little thing that she notices, it's about, okay, we've got to get an exam right away. We've got to take you in right away. We've got to take care of you right away. You've got to be there for your kids. But many of us don't have that person in the home, a physician living in the, as a matter of fact, I said to her, listen, if there was anyone I could be married to during COVID, having a health provider, you get A plus plus. Don't get me started. But
Yeah.
however, bottom line is this frustration is because I've heard this over and over again. If this is our only shot today, I would like to hear from both of you. What is it that we can say to our audience? And I suspect we're preaching to the choir, but they can get that information out there too, as to early intervention.
Yes. Yes.
What I would say. What I would say is, if you ask the question,
Yes.
ask the physician the question, and prepare questions before you go to the doctor, whether it's for yourself or whether it's for the person that you're caring for. That way you won't get distracted and you'll have an answer for all of the questions. And it starts with that, because from your questions, then the physician, like Dr. Sonia, will start immediately to do an assessment on you. But if write your questions down and just keep track of what you're asking the physician a lot of times, because you may need to go back to them. If it reoccurs, you may need to go back. So ask questions, write them down, bring them with you.
Yeah.
Dr.
I would like to add to that, Missy. Advocate for you. Pour all that love back into you.
That's
And
right.
never accept a closed door. You keep knocking on these doors, you keep advocating. And if you encounter a healthcare provider that doesn't have that energy of love for what they do and why they are here today, you move on and you keep looking, because this is all energy that we share between each other. You know, having that energy and pouring that energy and that love, you feel the warmth when you walk in to a door, and you know when you're going to be loved and held and supported. As Dr. Jeff said, if he wasn't married to a healthcare provider, where would he go or how would he seek that information out? When we need financial advice, we go to a bank. And if that bank isn't giving us what we need, we take our funds somewhere else. Truth, knowledge, all of that is power. And never stop or accept anything but the best for yourself and for your family. Advocate, research, expand, explore, and also do it in love and in grace. And
Yeah.
know that the answers are there and know that the support is there.
Even if they're fighting you all the way. So I've got it right, because you're doing it out of love. Wendy Miner, one of our superstars here at Compassion and Choices. If you go, ladies and gentlemen, to the chat, she's put down, written in a couple of things that you can do that you can get on our compassionandchoices.org. There's a diagnosis decoder that can help you in starting to look at the diagnosis of dementia and how you get that. There's also dementia values and priorities tool. Here, what we're doing is we're looking at who this person is, what is important about making sure that they deal with this particular illness and doing it in the right way, how to prepare for a dementia appointment. But I think it takes us to the question that I want to put out to everyone here and why we're here also. Our mission in Compassion and Choices, and that is to erase what we see as a health disparity in the Black and Brown community with regard to information about advanced care planning. So let me throw this out to the two of you again. And we touched on it a little bit, but why is advanced care planning so important, particularly with our family members who are beginning, to go through dementia while they're still what we call competent? For us I have a living will.
Yes.
If God forbid, I have dementia. Why is it important for us to have those things?
That advance directive speaks for you when you no longer have a voice. When you lack capacity to make decisions for yourself, that advance directive spells it out. You can spell it out all the way down to the specifics of any and everything you want. And it gives you the voice when you are no longer able to speak for yourself. It is your tool for advocacy. It is also your roadmap for your family so that they don't have to deal with those challenging, difficult, oftentimes confusing decisions that they are faced to make when you are no longer able to share your wants, your needs, your desires. How beautiful is it to have a roadmap, not a scavenger hunt, but a roadmap
Right.
for saying, this is what I want, when I want it, how I want it, and
Ab-
don't deviate from it at all.
Absolutely.
And that is the greatest gift we can give to people that love us, is having that advance directive, that roadmap
Absolutely.
to my.
Exactly. So we don't leave, our families dealing with that, with being the caregivers alone and knowing what it is that we do want. We have to end our little bit of a discussion because I know that Missy has some things that she'd like to explain. Brandy's coming back, but before we go there, Kate Greenquist, absolutely. She asked, does Compassion and Choices have advanced care guidance for dementia? Yes, that's what we've been talking about. And Morgan Dixon, by the way, brought up something which is important, and we're learning more and more about it. End-of-life doulas absolutely can be helpful. So, it's a team. It's a team, not just physicians, not just nurses, but a full team of providers that are there. So I know that we want to talk about our resources that we're putting out there. And Missy, am I turning it over to you or to Brandy right now?
I think that it's a slide for me to talk about.
Okay.
Yeah, well, I can take over and then pass it back to you, Missy. Thank you guys so much for this conversation. It was so candid and just so helpful and information packed. So thank you all so much for sharing your perspective.
Thank you.
And your advice is so in line of who Compassion Choices is. We are the nation's oldest and largest and most active nonprofit, working to improve care and expand options and empower everyone to chart their end-of-life journey, which is really echoing what we heard today about the importance of really understanding what your options are and then putting those that information in writing. And so we would like to empower everyone to chart their end-of-life journey, which is also another theme that came up today, and the importance of those, particularly those advanced directives and some of the tools that we have. Some of our resources that are available were discussed today, but in particular to dementia, we have our dementia tools and values worksheet. And that is found at our website, which is compassionandchoices.org, as well as our dementia decoder, which was spoken about today. And with that, you can go in and say whether you're a caregiver or you're a person who is facing dementia or just being prepared to face dementia. And it takes you through a series of questions to really help you identify what your values and priorities are, so that, again, your treatment does have some guidance. The people who are making those decisions for you are clear about what it is that you want or don't want, depending on when you're still lucid, which is the importance of starting early. And then I know Missy, as a caregiver, also has some information and resources through this complete guide of dementia for caregivers. Do you want to just talk about that a little bit, Missy?
Right. The complete guide for caregivers is an unbelievable site, and it has about 50 websites, and all of the websites have to do with dementia or Alzheimer's disease. Alzheimer's.gov is from the federal government, the Alzheimer's Foundation of America. They even have a site, and the site is called Dementia Friendly America. Also the Cleveland Clinic for Healthy Brains, the Caregiver Action Network, all things that are put together to support not only the patient, but to support the caregiver. When we're looking at patient-directed care, we also include the family or the caregiver, because they help to make everything happen for the patient. So you can go there and pick and choose the resources that will best serve you, and hopefully it'll give you some of the things that you need. Thank you.
Thank you so much, Missy. And we will follow up with information after the webinar with links to all of these emails, as well as the tools we have. So we have a short video to share with you that talks about the dementia tools in more detail.
Today, 5 million Americans are living with dementia. For many, that means years spent confused, unable to recognize their family members or care for themselves. And their lives are often prolonged by aggressive and unnecessary medical treatments. Of all the things I learned about dementia after Dad's diagnosis, the most important were his personal wishes for managing his end-of-life care. It's a difficult conversation.
But it's an important one. And it helps to know that my family isn't burdened making difficult decisions about my care on their own.
If you're not sure where to begin, Compassion and Choices has created 2 free online tools to help you take control of your care: the Dementia Values and Priorities tool and the Dementia Decoder. You can find them both at compassionandchoices.org. The Dementia Values and Priorities tool helped us define and record Dad's personal instructions for his care at each stage of dementia. Simply follow the prompts to identify the dementia markers that determine the care you wish to receive. Then print, download, or email a copy of your personalized dementia amendment to give to your family and healthcare providers as part of your advance directive. The Dementia Decoder is designed to help patients and caregivers ask the right questions when discussing dementia care with a physician. Indicate what you want to learn, choose the questions you want to ask, and print or email your customized list to take to your next appointment.
My doctor was happy that I came prepared to discuss and plan my care.
And knowing that she understood and supported Dad's wishes and had a copy of his advance directive was comforting for both of us. So if you or someone close to you has recently been diagnosed with dementia, take control of your life and care. Start making your plan today. Visit compassionandchoices.org.
So thank you all.
Today,
again.
5 million Americans.
So we spoke about the resources we have available, and I think we've answered most of the questions we had in the chat. In addition to our dementia tools, we also have our end-of-life care planning guide that has our tools to finish strong, our Plan the Care Resource Center, which can also be found at compassionandchoices.org, as well as our consultation 800 number, which also has Spanish language available, as well as our EOLC at compassionandchoices.org, where you can email specific questions about end-of-life care. And lastly, we have our COVID toolkit, which is also available in English and Spanish, and it is addendum and information to add to your advanced directive through the lens of COVID-19. We have an archive of previous webinars, so please visit our website to see. We've had dozens of experts come on and talk about different issues around end-of-life care. So please visit that website, our website, for more information. Follow us on social media. We're on Twitter, YouTube, Facebook, and Instagram. We want to give a special thanks again to our panelists who provided so much great information for us today. I wish we had more time. I think we could talk about this another hour if we had the opportunity. And before we close, I wanted to also just explain that Compassion and Choices is funded almost exclusively by individual donors like you, who are committed to the issues of end-of-life care and choices. So please consider making a donation today to help expand our work and ensure that everyone's priorities and values are met at the end of life. Every donation of any amount makes a difference, and donations allow us to continue doing programs like this and improving care and expanding options. So please do consider making a donation. And again, that can be found at our website at compassionandchoices.org/donate. So thank you all again so much for your time, and we look forward to the next opportunity to share some perspectives from some of our greatest supporters. Thanks again.